I'm Karen Rosa with the Arkansas Career Pathways Initiative. The initiative in Arkansas is a partnership between Arkansas Department of Higher Education and Department of Workforce Services. I will represent and tell you about the program at the two-year colleges in Arkansas, and Elroy Willoughby is the representative from Department of Workforce Services, and he will share with you the eligibility criteria and the funding for the initiative. The Arkansas Department of Higher Ed actually receives the grant from Department of Workforce Services. We then sub-grant to 25 sites, all of the two-year colleges. Within each of those colleges, we have built an initiative that serves students with tuition, childcare, transportation, all of the barriers for students. In the 7 years that we've had the initiative, we've learned a lot. Actually, the client was not someone we expected to serve. When we wrote the proposal, we thought we were going to be delivering a program to 18 to 24-year-olds. Our students, the characteristics of our students have been interesting to us. Actually, they're 31-year-olds, single-parent mothers. A lot of them are single-parent mothers. We've served over 22,000, enrolled over 22,000, and we have issued over 20,000 credentials, certificates, or degrees in the program. At the colleges, the programs that are offered by law, we're a legislative mandate, Act 514, and that says that we serve students who will be employed in high demand, higher wage programs. We did a gap analysis and identified what would be in demand in Arkansas, and that would be allied health. So about half of our students, more than half, are enrolled in allied health. The other half is split between business, some type of business administration, and a technical career. It may be welding, it may be avionics. The student population is made up of 90% female, and I'm going to let Elroy tell you just a little bit. People are always interested in what is your eligibility criteria when we start talking about our students.
Thank you, Dr. Rosa. Again, my name is Elroy Willoughby. I'm with the Arkansas Department of Workforce Services. We're so happy that we had the opportunity to partner with Dr. Rosa and our Arkansas Department of Higher Education. We found that many of our low-income citizens did not have sufficient access to post-secondary education. In that instance, the Arkansas Career Pathways Initiative grew out of that, and we began to partner with our Higher Education State Department as well as our 25 two-year and vocational educational institutions around the state of Arkansas. To be eligible for the Career Pathways program, you have to be TANF eligible because we are utilizing our Federal Temporary Assistance for Needy Families program dollars, and also you have to be a parent of a child. One of the things that we found that oftentimes our low-income individuals did not have the access or the motivation or the support to pursue post-secondary education. Through our network of local offices across the state, we are able to assist our low-income and our TANF recipients in getting an idea of what they want to do for their careers. Not only do we assist them in determining what they want to do, we also offer them the appropriate support and motivation to do it. Through our partnership with Dr. Rosa, we are also able to identify not only their needs and their goals, but also identify some of those gaps, be it skill gaps or educational gaps, that will help them be successful. Dr. Rosa, would you like to talk a little bit about the skill gaps?
Yes, Elroy, I think that one of the most rewarding things about this initiative has been the unintended consequences or findings that we've had. And in addressing skill gaps, we have put in a program that is unique and can be used for fast-track DevEd. We've been recognized for this program nationally also. We do, instead of a Compass test for college entrance, we do a Compass diagnostics. And if the student is in math low just in fractions, we address that. It's a 31-year-old, and they may not have used fractions, but may not be level in every math level that they've been using. So we have purchased software. We purchased, used some of the one-time money to set up small computer labs that are not intimidating. We then use a facilitator and take them through a computer program that may address only fractions. At the end of that short period, we let the student retest rather than spending a semester in a dev ed class and using up all of your federal aid. We have used a facilitator, smaller labs, and some computer programs that address that. And so consequently, we've been recognized for what we call our fast track dev ed in that Elroy. And of course, the students don't wear out. It's a shorter time frame. Our non-traditional students are impatient. They're ready to go into college or to retest. So we've used that successfully within the program. The surprising statistic that we have on our students is we thought we would be serving a lot of GED students, a lot of students who had not finished high school. Most of our students, as I said, are 31 years of age, and in all of the years that third-party evaluators looked at our data, they also have a year of college. So again, we're serving an invisible person in the community that's not being recruited traditionally by the two-year college, that's working at the Quick Stop or working at a factory. We have very high scores on the NCLEX test, on the GED test, some of the highest in the state. And they are, in Arkansas, the large pool of people that can be developed into a workforce. As a state, we do a good job of completing GEDs, completing high school, but the student in there that's 31 is not being recruited. And I think that's the thing that our college presidents have learned. If this money goes away, I think one of the sustainables will be the person in the community that becomes invisible and is not being recruited. And all we need to do as an agency, and of course using the funds from TANF, is to address those barriers of childcare, transportation, how do I pay my tuition, and the case management that we've learned from Department of Workforce Services. You all always had case managers following a client all the way through to make sure they were successful. And we have replicated that at the two-year college, and we have case managers that follow a student from entry into the program or enrollment all the way through to bridging them with an employer.
And that's a very important point, Dr. Rosa. Due to the fact that our Temporary Assistance for Needy Families program is time limited, and more so in the state of Arkansas, we have a 24-month limit. So it is very important that we diagnose our students,
right,
identify those gaps, both educationally and skill gaps, and try to address those in as fast a fashion as we possibly can. Again, we are dealing with adult students,
right,
non-traditional students who, in my parlance, life happens for them every day. So they need a little bit of help, a little bit of assistance to make it just above that notch where they go from government assistance, right, into self-sufficiency and into careers.
Elroy, we call it the tyranny of the moment. They not only have homework to do for one of the first times, they have to work to be eligible, so they have a job. They have children, they have transportation problems, they have motivational problems, so they have all of those things. And we say that our students live in the tyranny of the moment. And so we try to assist them with not only educational barriers, but also some of the emotional barriers at the same time. The interesting thing is that our higher ed presidents are now won over because another unintended consequence that we were hoping for but we were not real sure of is when we matched our data of the pathway students to the database at higher ed. We had a 10-point higher success rate of very hard to serve non-traditional students. And it has, every year that we've measured the data, it's stayed that way. So I think this is a pattern that can be replicated. I think it's one that needs a lot of attention even in other higher ed institutions that do not have career pathways because the model works. It's, again, the case management, and it's providing those fast-track dev ed. It's addressing the barriers within your state or within your region, and our barriers are different in all of the local areas. We are in very rural Arkansas that has no transit system, and then we're in the Delta area of Arkansas, and we actually let those program directors and the president take that grant money and address the barriers that they need in the local area. And we appreciate the partnership that you all have trusted us enough to let us do that with it. We subcontract, and then we work daily with those program managers to make sure if it's more transportation money they need on their budget, it's not a cookie cutter program. We've actually let them address that, just like we let them address the jobs that are needed in the workforce that's needed in their area.
Dr. Rosa, you know, we've talked so much about the Career Pathways Initiative. Would you be willing to share one of our student success stories with our audience, please?
That is another thing that we've learned with this program, that pictures tell more than one story. They tell a lot of stories. When Secretary Sebelius came to Little Rock to visit our program, we actually sought out a student, and again, our students are busy, we never get to prep them, and an employer. And we had Brittany Turner, a young Hispanic lady, tell Secretary Sebelius and the entire room that she started as a dishwasher. She was pregnant at the age of 16, had no idea, but was a 4-point student, didn't know how she was going to make it through school. Her scholarship money ran out before she finished as a CNA. She ran into the Pathways director, and the Pathways director said, "Brittany, I can help you." Brittany started at the same employer where she is now as a dishwasher and is now in the RN program. She told about having her home paid for, raising her child, adopting some other children that were in the family, and having, she said, 2 vehicles paid for, and gave all of the thanks and the praise to the local Pathways program there at the college in Pulaski County. And your board had her a couple of weeks ago.
That's correct.
And she told the same story to the board, and I didn't see a dry eye in the room. So those stories like that certainly have given us the attention that we need from your board. And just it shows us the strength of the partnership. It really is evidence that this program is working.
And I think that's a great testimony to the fact that you can get previously siloed federal and state organizations and agencies to work together, that we can have more of those success stories like Brittany's.
Because I don't know that she would have found your local office. I worked in higher ed for years, and I would tell students that they could get assistance, but I really didn't know the linkage. The other thing that we've done, another unintended consequences, we have a great network in our local communities of resources that are documented and linked for the students, because we in higher ed would tell them about Pell Grants or something that we knew about. But we have been forced to know where the T offices are, where the DHS offices are, and I think that is another resource that was unintended in the beginning and is a great strength for these communities, a sustainable community at this point in time.
Absolutely. And one other thing I think has come out of the Career Pathways Initiative, you talked about the partnerships between Department of Workforce Services and Department of Higher Education. We also have our Department of Human Services, as well as our Department of Education and our Workforce Investment Act programs. So we have a lot of collaborations that are going on both officially and unofficially that have come out of the Arkansas Career Pathways Initiative.
I think partnerships can only strengthen initiatives, especially when we start talking about resources in a state where the poverty level is so high and the education level is so low. I think that the only way that we're going to make the needle move is to use the strengthen initiatives with partnerships, because alone we never have enough.
Hi, I'm Lisa Washington Thomas, the branch chief for the Technical Assistance Branch in the Office of Family Assistance. I want to thank you for watching our video brought to you by the U.S. Department of Health and Human Services, Administration for Children and Families, Office of Family Assistance.